Good afternoon. Thank you for joining me in this discussion about pediatric feet, particularly about flat feet deformity in a child. Um, let's talk about the 7 truths you may not know about your child's feet. Tip number 1, uh, flat feet is not normal, but it does not always require intervention um, by, by a physician. Truth number 2, symptomatic flat feet should always be seen by your physician or your foot and ankle specialist. Number 3, in-toeing, also known as pigeon-toed, is normal at a certain age, but if persistent, can be a problem long-term. Any questions, see your physician. Number 4, flat feet can cause heel, knee, back, and hip pain in a child. Number 5, the tight Achilles tendon can cause the flat feet to get worse. Number 6, early intervention and evaluation can help prevent painful surgery for your child. Number 7, sometimes an extra piece of bone that your child was born with may be the cause of the child's flat feet. The reason for making this video is a lot of patients have asked me to talk about flat feet, and particularly we see a lot of pediatric flat feet deformity, where the concerned parent comes in and say, hey, my child has flat feet, or a pediatrician will refer a patient to see us for flat feet evaluation. Sometimes the kids are asymptomatic, sometimes they are very symptomatic. So let's go over what a flat foot looks like on a bone model, and we'll discuss some treatment options from that point on. We're going to look at this normal arch with the anatomy. So you can see the almost like a long triangular shape of an arch. This provides a good mix of shock absorption as well as stability of the foot. Now we're going to go to a flat foot deformity. As you can see, the arch is flat. Particularly, we're going to see that this bone is very prominent on the bottom of the foot. So if you notice on the inside of your ankle, you can have a little prominence on here. Another thing you've noticed that we see in this foot model, I'm going to hold it up together. Oh, not as easy to see, but you'll notice that this foot right here is normal. You see on the outer edge right here is very nice and straight, and on this foot the outer edge bows out a little bit. So that's why when people have flat feet, you see not only the flat arch with the prominent bone here, but you also see the foot pointing out towards the side. So some people have a waddle or duck gait. So let's talk about this. Again, not a lot of people need any kind of intervention if they're asymptomatic, but as a concerned parent, I could see why you want the best for your child. And sometimes just proper shoes are very important. New Balance makes good shoes for kids. Something with a nice support, as I talked about in my how to choose shoes for your child. This support right here is very important. It should never bend about the arch, and the shoe should bend around the toe area. That is the most important part of buying a shoe for a child. Again, my video talks about that, how to buy shoes for your child, especially for back to school. Now, let's talk about that extra piece of bone. That extra piece of bone is right about here on this foot model. The tendon, called a posterior tibial tendon, goes behind the ankle and goes into this bone. Sometimes the first time a patient will notice this is if they're playing sports and they twist their ankle, not twisting in this way, but out. They twist not in, but out, and then they sprain this tendon on the inside. Sometimes that's how I first get to see the patient for this particular type of problem, and then we address the extra piece of bone. It's also called a kidner, K-I-D-N-E-R foot. That extra piece of bone can be very painful, very prominent. Sometimes it could be red and swollen on the inside of the ankle. Basic treatment for that, if it's the first time having pain or symptoms after a traumatic injury, it will be immobilization, ice, rest, physical therapy, and a lot of times the shoes are not supportive, so we go ahead and talk about shoe gear and custom orthotic therapy for the child. A majority of the time, that's all it takes, but for the minority of patients, surgical intervention is required, and the level of surgical intervention needs to be determined by your chosen physician. A very interesting fact when looking at these two bones, these two foot models, as you can see, the flat foot right here, normal foot, how the normal foot has a straight edge, the flat foot goes out this way towards the side, creating that waddle or a duck-like gait. So there is a surgical procedure called the Evans, EVAN apostrophe S. This is a tried and true method. Basically, the surgeon puts a bone graft on this side and it swings the whole foot back over straight. That is a very easy, tried and true method that has been around for quite some time, and it's been very predictable. The bone graft absorbs and becomes a piece of your child's bone, heel bone, and the flat foot is corrected the majority of the time. A newer procedure that's been on the horizon for quite some time and more popular among the podiatric community versus the orthopedic community, although it is gaining more acceptance in the world of orthopedics, is something called a subtalar joint implant. This is a foot model. This is a normal foot with a nice arch, but if it was flat, you can see that this bone would be collapsed. This bone will be collapsed. It's hard to tell, but there is a joint right here. There is a little pocket. For the implant, the surgeon will stick an implant right here, right into this joint, to prop the arch up, so that way it doesn't fall. And that has been a very good procedure for mild flat feet with mild symptomatology without any involvement of the tendon or extra piece of bone. That can be very effective. Again, the selection of the procedure is very dependent on your chosen surgeon and the amount of symptomatology of the child, and if they failed conservative care. So thank you for listening to this video. Hopefully I could provide more videos and educational material for you. Please visit our website at www.naplespodiatrist.com. Comment on our Facebook page. Follow us on Twitter. Anything you want to hear about, hopefully I can help you address.